Good morning. How you doing? Yeah, it's a Jungle Thursday here. Have a look. Yeah, very nice. Yeah. So we got a couple questions today, and we've got a vaccine update. So let's do the questions first. First question is from I'm sure I'm mispronouncing this. It looks like Magali or Magali. Yeah, I don't know, or it could be something totally different. Anyway, in San Antonio. So the question's long. Let's sum it up. So, Magali's 83-year-old mother had to go to the hospital, and that's totally normal. Yeah. There have been a real drop in the number of people going to hospital for all causes, like even things like heart attacks, even things that people are probably still having. And so that's been a problem. People are kind of afraid to go into the hospital for fear of catching COVID. And it tends to be older people who are already at most risk for a variety of other things. And so, yeah, she's saying that we had to go there because what else are we going to do? And yeah, totally, that's right. That is what I have heard hospitals and doctors saying is like, yeah, if you're sick, please do go to the hospital. They'll find a way to try to keep you as safe as possible. Okay, anyway, while at the hospital, there were people in the waiting room, and they were about 25 feet away for about 10 minutes, and they were coughing, but they were wearing masks. And so these people, you have to assume, may be COVID patients. Anybody, yeah, it pays at the moment to assume the worst and take action as if the worst was true, basically. Yeah. Just in terms of you assume that pretty much everybody's infected, and yeah, don't let your guard down because that's how the virus gets you. And so good. It sounds like we're very much keeping our guard up here. And then been under house arrest for a couple of months now. Yeah, which is true. And so the question is what to do going forward. So was this an exposure? And the answer is nobody can tell you. And even if they were able to confirm that the people in the waiting room were cases, I don't know that they would be able to connect that you had been in the waiting room at the same time. And I don't know that a contact tracer, if there's even one assigned to the case, would find you. So you got to contact trace yourself. You got to wake up every morning. You got to take your temperature. You got to ask yourself, do I have any signs of respiratory distress? Is my breathing, normal and fluid? And as long as that's the case, you're probably okay. But yeah, you want to assume that you may have been exposed, and you probably want to do your best to self-isolate for 2 weeks. Now, it sounds like you're caring for somebody else, and so the question is there somebody who can care for you and bring you and your mother groceries and just make sure you're taken care of? Because that's also the key thing. If you do have to go out, you're going to wear a mask, but it sounds like you already are, and thank you. Thank you. I wish more people were, but thank you. So that's at least as far as I can say, based on it's not even really the science. It's like just experience handling the virus. You got to always assume that the virus, yeah, has spread as far as it could possibly spread, and you've got to take action as if that was the case, and you do that, and you'll stay safe. So I like what you're doing. Please do stay home for 2 weeks. Please do keep checking your temperature, and if you need to go and get a test, you want to see if there's one of those drive-through testing sites. I haven't looked at San Antonio. I know there are some in Dallas, but if there is one somewhere in the vicinity, that's a nice safe way. So it avoids you potentially getting re-exposed as you're getting going in for a test if you were going to a hospital or a clinic, something like that. So yeah, there we go. Try, yeah, stay safe. I mean, you're doing everything you can, but it'll probably be all right. I very much hope it'll be all right. And let me know. Let me know if everything goes okay. Thank you very much. This has been Ask Dr. Ben.